Today I wanted to chat with you guys about breech babies and a couple of things that you can do at home to aid in any outside help that you are seeking when it comes to trying to get your babies to flip so that they aren't breech when it comes time to deliver them. So just a couple of things before we get started with the two techniques that I want you to adopt into your daily practice. One, if you are a Bloom Method mama and you are doing our ab wraps, our deep core holds, and really any core specific exercise that's really challenging the strength component of the pelvic floor and the TVA muscles, I want you to ease up on those just a little bit. Really ask yourself what's more important, my really strong abs or getting my baby to flip. I'm not saying that you have to completely get rid of all strength training core specific exercises, just downplay them a lot. If you were doing around 8 to 10 minutes a day, do 3 to 4. Just do some belly pumps, focus on your diaphragmatic breathing, focus on implementing your core activation with functional movement and allow that to expand instead of core specific exercises that really build that endurance strength component of the muscles. Because right now the focus needs to be on softening to create space for baby so that baby has the room to flip. So with those core specific exercises, again, if you're doing ab wraps, deep core holds, belly pumps are fine. You can continue doing those like you are. But with the deep core holds and the ab wraps, let's switch it up. Let's decrease those as well along with those core specific training exercises, just again, because we really want to soften everything. So we're going to decrease the amount of time we spend really strengthening that inner core unit, and we're going to up the softening aspect. And that's what I'm going to show you guys today. A couple of other recommendations that I personally would recommend outside of what you could do on your own is to seek out a chiropractor that works specifically in the Webster technique that could help get the pelvis in alignment so that baby has the space to flip. Oftentimes, if the pelvis is torqued in one direction or the other, or tucks under, kicks out, that can cause some issues when trying to get baby to flip naturally. Spinning babies is also another really great methodology that has worked for a lot of my clients. And then potentially some deep massage work. So some soft tissue, fascial, myofascial work would be really complementary to what you're trying to do in regards to get baby to turn. Okay, so what we're going to do today is we're going to talk about these two techniques that I want you to implement into your daily practice. You can actually do them multiple times a day if you want. So we're going to start by just coming onto all fours. So when you do your belly pumping, if you have a specific time of the day that you're setting aside and really trying to amp up your belly pumping, I want you to add this to it. You're going to come onto all fours. You're going to slightly bend your elbows. Make sure all of your joints are stacked. So shoulders on top of wrists. I want your knees stacked underneath your hips, and I want you to have a neutral spine. So you're going to take the concept of diaphragmatic breath, but you're going to focus on your inhalation. So while everything stays the same, you really allow the expansion of the rib cage, gentle expansion of the belly. We're still not trying to press out, and that lengthening aspect of the pelvic floor to be your main priority. So again, we're trying to soften those abdominal muscles and inner core unit muscles so that we create space to allow the baby to turn. So it's shoulders down the back, let everything be soft. You can even let your head hang. Inhale, exhale, no activation. Inhale, exhale. Notice that I'm not tucking or tilting my pelvis. My spine does not move or change. Everything that's happening is happening in my inner core unit. Diaphragm, TVA, pelvic floor, and the multifidus are involved too. Good. Check in with those shoulders. Really trying to find softness in the body. this is it. Super fun. Coming onto all fours also allows that expansion to be a little bit bigger. Puts the body in a more comfortable position if you're later in your pregnancy. It takes, pressure off of the spine and pelvis. So this is just a really yummy position to be in to really help soften that inner core unit to create space for the baby. Now we're gonna step it up a little bit. You're gonna take a pillow and you're gonna place your knees on it, and then you're gonna grab another pillow for your elbows or your forearms. And you're gonna come into that all fours position, but then you're gonna drop to the elbows. And I like to kind of make a triangle so my fingertips are touching. I'm actually gonna flip my palms up so that my forehead can rest there. And you're gonna come to the pillow. So you're gonna drop your forehead on the pillow, drop the shoulders down the back. Let that booty blossom behind you. And find your diaphragmatic breath. The same breath that you just had in your all fours position. Your focus is still on the inhalation. But we've got you in this like little baby inversion to allow for positioning for baby to flip. Inhale, expand rib cage, belly, pelvic floor. Exhale, let it fall. Really making sure that you begin the inhale at the rib cage. So focus on laterally expanding the rib cage and then allowing that pressure to move down into the belly and pelvic floor. Both positions are also really, really great to try to feel the lengthening aspect. Even sometimes, really, it's the differentiation between the activation of the pelvic floor and the lengthening aspect of the pelvic floor. Because of the position, especially in that second one where we had your booty up and you were in that tiny little inversion, because of the positioning that puts your pelvis in, it's really, really great for helping you feel that lengthening aspect of the pelvic floor. So if you're someone who knows you're hypertonic, so super overactive pelvic floor or more tone in your pelvic floor than is necessary, practice that release of the pelvic floor. Really try to connect to that since you're focusing on the inhalation anyways. And then if you're having trouble on the other side, if you know that you have not enough tone in your pelvic floor or weak pelvic floor, that, because it opens up the pelvic floor naturally, again, can give you this really great foundation of feeling the lift and the release. So whichever you know that you need to work on a little bit more, just focus on it in those positions. But make sure you're focusing on the release, the opening of the TVA, the opening of the rib cage, the opening of the pelvic muscles, so those pelvic floor muscles in both of those positions. Do those every single day. As much as you can. If you can do it a couple to 3 times a day, the more you can do it intermittently, the less time you need to do it all at once. So if you're a super busy mama on the go, then find a few different times throughout the day that it makes sense for you to do it for 1 to 3 minutes. If you only have a condensed amount of time, I'd recommend doing it for more like 5 to 8 minutes. And hopefully it helps. Both of those techniques with that really focused diaphragmatic breath have proven to help so many of my clients, again, along with the Webster technique chiropractors, with some myofascial work. There are other elements that really, really are crucial when trying to get babe to flip. But the most that we can do at home to aid in that, the better, right? So again, just trying to put you guys in charge, have a little bit more control over your pregnancy, your birth, and your experience. If you have questions, as always, put them down below. We always check the questions, the comments. We will show love to you, and we appreciate you tuning in. Hope you found this helpful. See you soon.